Your feet are trying to warn you about serious health problems, but most people ignore these signs. I'm Dr. Pelto, and I can tell you that your feet are like a window into your health. But here's what shocked me. 90% of people miss these warning signs until they're too late. Because the health problem that could change your life forever might be showing up in your feet right now. Your feet are the farthest point from your heart, which makes them perfect early warning system. Your feet receive the least oxygen and have the smallest blood vessels. They also have the longest nerve pathways from your brain and your spinal cord. Therefore, when something goes wrong with your circulation, your nerves, or how your body works, your feet show the signs first, sometimes years before the other symptoms appear. During my career, I've recognized diabetes, heart disease, and kidney problems just by examining my patients' feet. But you need to know what you're looking for. Number 1, numbness and tingling in your feet is your nervous system crying out for help. It usually starts in your toes and works its way up your legs. You might feel burning, shooting pains, or complete numbness. Eventually, you lose balance and coordination. This is often the first sign of diabetes. The high blood sugar can damage your nerves. But the numbness could also mean vitamin B12 deficiency or even thyroid problems. The real damage is that you can't feel injuries, leading to serious infections. Number 2, your foot color tells a story about your circulation and overall health. Pale feet, especially when elevated, suggest poor arterial circulation. That's the blood flow that's going from your heart down to your toes. This could be peripheral arterial disease, the same process that causes a heart attack and strokes. Blue or purple feet mean you're not getting enough oxygen. This could signal heart problems, lung disease, or even blood clots. Persistently red feet might indicate poor venous circulation. That's the blood flow that's going from your toes back up to your heart. But sudden redness with warmth could mean a serious infection. Number 3, wounds that won't heal are screaming that something is seriously wrong with you. A small cut should heal within 7 to 10 days. If wounds take weeks or months to heal, that's a red flag. Poor wound healing is often the first sign of diabetes. It could also indicate circulation problems or an immune system issue. But here's the real danger. These wounds can become serious infections. Diabetic foot infections are the leading cause of non-traumatic amputations. Number 4, foot swelling is one of the most serious warning signs you can't ignore. Go ahead. Press your finger into your foot for 10 seconds. If it leaves an indentation, that's called pitting edema. Also, deep sock marks that stay for hours after removing your socks is a sign. Shoes that suddenly feel tight, especially at the end of the day. This could signal heart failure. Your heart can't pump blood effectively. Or kidney disease. Your kidneys can't filter the excess fluid. If swelling appears suddenly or with shortness of breath, seek immediate medical attention. Number 5 is stinky and painful feet. This combination is more dangerous than you think. When your feet smell terrible and they hurt, you likely have a bacterial infection. This isn't just athlete's foot. Bacterial infections smell much worse and cause severe pain. In diabetics, this combination can lead to life-threatening infections. The infection can spread up your leg and through your bloodstream. This can cause sepsis, a condition that kills thousands every year. If your feet are both stinky and painful, especially with redness or pus, see a doctor immediately. This usually requires prescription or IV antibiotics, not just the over-the-counter medications. Number 6, your foot temperature tells you about blood flow and nerve function. Persistently cold feet, especially if one is colder than the other, it suggests a circulation problem. This could indicate blood clots or blood vessel blockages. Feet that feel hot or burning, especially at night, often indicate nerve damage. This is common in diabetic neuropathy. If one foot is significantly warmer or cooler than the other, that's concerning. This suggests a problem with blood flow to that specific foot and can indicate even an infection or even a condition called Charcot foot. Charcot foot is a broken foot in someone with neuropathy who continues to walk on it, and it is a serious condition, and that can lead to an ulcer, a wound, or an amputation. Number 7, restless legs and feet with crawling sensation are more serious than most people people realize. Uncomfortable, crawling, burning, or tingling sensations that make you want to move constantly. It's worse when you're trying to rest and completely disrupts your sleep. Restless leg syndrome is highly associated with chronic kidney disease. It also could indicate iron deficiency or problems with blood cell production. The underlying cause is often related to nerve function and circulation. Some foot signs require immediate medical attention. Sudden, severe swelling with shortness of breath, stinky, painful feet with pus and red streaks scoring up your leg, sudden color changes with severe pain, complete loss of sensation in your feet, gradual changes that persist for more than 2 weeks, multiple warning signs appearing together. A proper foot evaluation includes a circulation test, nerve testing, and sometimes imaging like X-rays or MRIs. Early detection and treatment can prevent serious complications. Your feet are constantly sending you messages about your health. Take a few minutes each week to really look at your feet and check for those warning signs. I've seen early detection save lives and prevent amputations. If this opened your eyes to what your feet are trying to tell you, give it a thumbs up and subscribe. Check out my other videos on diabetes prevention and circulation improvement. Remember, your feet are your body's early warning system. Listen to what they're telling you before it's too late.